Hello, my name is Mary Coupland and welcome to The Road Ahead. Through a series of guests, we're going to help you navigate your own road ahead as you age. We will help you and your parents prepare for your journey. Let's face it, nobody wants to find themselves in a crisis mode simply because they did not have access to information well in advance. As the publisher of Compass and Clock, we will help guide you into your best future. Today, our guest is Charla Wright of Assured Hospice. Charla is a patient care representative with Assured Hospice serving Jefferson and Clallam County. She has been an advocate in the healthcare industry since 2011, providing policy protection, would the word be, or policy updates, advocacy, Medicare changes, and she's a big volunteer in her community. Charla, welcome to The Road Ahead.
Thank you, Mary, for having me today.
I'm thrilled you're here because you are definitely the go-to girl to talk about this very topic, which today's topic is, what is hospice? Mm-hmm. So let's start off by this. Most people hear the word hospice and they think end of life, dying. Yep. And they really don't understand what it is. So can you tell the viewers a little bit about what hospice truly is?
Well, the first thing, and you kind of mentioned it, is hospice is not just for when you are dying. And we as a team try to go into a home and help everyone, even the caregiver. But you don't need to be lying in bed actively dying to have and benefit from a Medicare hospice service. We don't want to go in a crisis mode. We would like to be in, get everybody settled, get everybody who needs our support, give them what they need, and then back off and let them live the rest of their days.
So what is the difference between hospice and palliative care? Because you hear those two kind of interchanged.
That's confusion as well. Palliative care is when you are kind of ambivalent about what direction or course of treatment you're going to take, but you have a terminal illness, but you still want curative treatment. Maybe you still want to have radiation or chemotherapy. So you'd want to go with palliative care. You still need some support, but you still are seeking treatment.
And it's kind of pain management too?
Yes, in
That's
both.
what I've heard. Okay.
Both services. Hospice is when you've exhausted your treatments. You've now have decided quality of life over days or months, and you just want to, live pain-free and comfortable and have support there for you and your family.
Okay. So I've heard the term 6-month criteria. Mm-hmm. What does that mean as it pertains to hospice?
Medicare is a federal program, and they do have the criteria of a terminal diagnosis, if it took its normal disease course, would have a prognosis of approximately 6 months or less. So your primary care physician would sign a certificate of terminal illness saying just that. That being said, we have patients at Assured that have been on for more than a year, even sometimes 2, because disease take different time frames to progress.
Yeah, and different people.
Right. So
hospice comes with many benefits and services. Can you tell us about a few of those that Assured Hospice provides? But I'm sure a lot of them are similar to other hospice agencies out there. So
yes, most all of Medicare hospice agencies and even at Assured Hospice provide a team approach. So we have the certified CNAs that will go into the home and provide hygiene care, bathing. The nurses come out a couple times a week at least to begin with, and it might be daily towards the end. We have a bereavement coordinator that sees our patients and families 13 months after the patient passes to help with those milestones, first holiday, anniversary, Christmas. We have our clinical social workers, volunteer team. We have comfort therapies that consist of music, aromatherapy, Reiki, massage, and all of that is part not only for the patient, but is there to support the family and caregiver.
So do some of these other services that you mentioned, like music therapy or Reiki, um, or pet therapy, if that's one of them, are those covered by the insurance? How does that work?
So the comfort therapies are separate than a Medicare coverage, and our foundation, the Assured Home Health and Hospice Foundation, raises funds to cover those types of comfort therapies. And the foundation also provides things like burial if they are having a financial hardship. We've even paid for vaccinations for the pet to go see their loved one in a nursing home, sending kids to grief camp. Maybe it's paying some utilities or food. So our nonprofit side raises money to help fund those things that Medicare or a family can't provide.
So would that be common in other hospice agencies across the state or across the nation, that there's usually a side to the hospice that offers these other services and support?
I can't speak for every agency that might have a nonprofit, but it is not uncommon for most agencies to have a nonprofit side.
Okay. So on one of the earlier statements that you were saying, you were talking about hospice and helping caregivers and others with support. So hospice is not just for the patient, correct?
Correct. Our nurses and our team provide not just the physical care for the patient, but also education to the caregiver and family. We want them to be able to take care of their loved one, and they educate them on signs and symptoms, what's normal, what's not normal, what to expect in the process, because the patient is going to show some change in behaviors or communication that may be uncomfortable for someone who doesn't know, but if we can front load them, educate them, then it's not so scary.
Which, again, when people hear the word hospice, they think scary.
Yeah.
And through the education I've received from you and other hospice agencies I've been connected with, what words come to mind for me are dignity and respect and peaceful and just very supportive.
Yes, yeah. We even, we'll make sure that we respect their culture, or maybe they're a veteran. We want to get them a volunteer veteran that speaks their language that maybe I don't have because I'm not a veteran, but our volunteer veteran can speak to our patient veteran in a way.
I thought you talked about a veteran program that you do right now, and you wrote an article in the Compass and Clock magazine.
Yes, I did. It's our Vet to Vet program where we match up our volunteers with a veteran, and they have their own language, and it gives them great comfort to talk to another veteran about their experiences, and it brings them peace. Again, it's providing the whole picture and whole care for that patient.
It really takes into account the person themselves, not the disease.
Yes, yeah.
So when I think of hospice and hospice care, I think of home. But home is where your heart is and where you lay your head.
Right.
So where can hospice services be provided?
Hospice can be anywhere. It can be in a skilled nursing facility. There are some criterias with Medicare that you would have to check with your nursing facility about. Assisted living, independent home, group homes. We've had several people in group homes, dilapidated trailers where we're not even sure we're going to be able to get a hospital bed inside, but we do, and that's where their home is. That's where they want to be. If I took a poll of 100 people and asked them if they wanted to die in a hospital, I'd probably have two hands people hold their hands up, but no one wants to die in a hospital. They want to be at home, wherever that is.
Surrounded by loved ones,
Right.
and familiarity and
The sounds and smells that, is in your home.
Yep, it makes a difference.
It does.
There was another question I was thinking. I know insurance plays a part in this. Can you talk a little bit about that, how that works? And
Yeah, hospice is a government program through Medicare, so we all pay into it. and it is 100% covered through Medicare once you're enrolled. You do not have any deductibles or co-pays to pay any longer once you're admitted into hospice. And we cover everything from your medical equipment to medication to incontinence supplies. Everything is covered, and our team. So it's a government program, and we all pay into Medicare for it. And that's consistent because it is a federal program across the nation.
And one of the last questions I want to ask, because we're running out of time already, these episodes go so fast when we're trying to educate you. How do you know when you're ready for hospice or that a loved one's ready for hospice? Can you wrap up with that for us, that thought?
That's a personal decisions that you have with your doctor, but when you are no longer going to be seeking that curative treatment, you know you've exhausted all your options, and you're ready mentally to just live your life with your family and not feel sick and uncomfortable and pain. We encourage our community to educate themselves, speak to their physician, because that is a group decision that you and your family and physician have. And then you give us a call, and we'll just help transition you or just educate you, and then when you're ready, we'll help you.
And when you say give us a call, the physician calls or the family can call, or it can be a combination of both?
Anybody can call. The patient can call, your spouse, or the physician. I think it's about 75% of the time we get a call from a physician or a clinic, and then some people just walk in the door and say, I need hospice for my mom or my wife or husband.
Are there any parting words you would like to share with our viewers about the hospice services and benefits and anything?
I would suggest that contact your local Medicare hospice agency when it's time to seek curative or seek support in the home, wherever that home is. We have a lot to offer, and we're there for that patient and family.
The one thing that I know I have heard repeatedly for at least 5 years is, don't wait to the last minute.
Yeah.
And so many folks that have secured hospice, their words are, I should have contacted them sooner.
Yeah, yeah. Again, don't wait till your loved one's in bed actively dying. Oh, we'll be there if that's the case, but crisis mode is not the way to enter your final few days.
Right. Peacefully, quality of life. Go on your own terms.
Yep.
So, well, Charlotte, thank you so much
Yes,
for educating all of us on hospice services and benefits. For those of you out there, thank you again for spending a few minutes with us. I look forward to chatting with you the next time. Have a great day. Bye-bye.